Well, joining us now, Mark Leibovich, national correspondent for the New York Times Magazine and CBS News political contributor. Okay, so Mark, Senate Majority Leader Mitch McConnell's already downplaying the report. We saw this happen last go round, and he's saying this time, whatever the CBO says about the House bill, the status quo under Obamacare is completely unacceptable. So how important are these numbers really?
Well, I mean, Mitch McConnell is not the first Republican on the Hill to disregard the CBO numbers. I mean, pre-disregard or post-disregard them if you go by their last scoring. I mean, the problem with the Republican argument here is that they're not sort of putting the status quo against the not status quo. I mean, what we have here is a bill that has a lot of details, that will have a lot of cost associated with it, that will have a lot of deficit potentially impact, then we're going to learn more today. So you can't really, predict it. But I mean, the fact is that this CBO score could very well be another big hunk of bad news for Republicans on the Hill for a bill that's already quite unpopular if you believe polls. So I think there's a lot of I guess you'd call it, just sort of planning the environment for what could be a bad score.
You talk about that bad score or bad news. What are the key numbers that we should be looking for in this?
Two things. One, I mean, number of insured people that this would take off the health rolls, but also deficit reduction or deficit increase. I mean, for the last 7-8 years, I mean, the deficit around fiscal conservatism, the Tea Party, has been really issue one, and this would give you an opportunity, or Democrats the opportunity, to say, look, you've been saying for years that the deficit is really the one issue that's driving and animating everything, and yet we have this score that says the deficit's only going to get bigger, especially when you have a budget that has so much military spending and doesn't really cut entitlements and so forth.
Mark, this narrowly passed the House, 217-213. We know if this new score doesn't match savings targets that are required by the Senate Budget Office, then the House may likely have to vote again. If they don't have enough support from their own members to pass this, I mean, where does this go from here?
Well, I mean, I think obviously everyone on the Hill, or at least in Congress, and the Republicans in Congress want to avoid another vote because they just got by before on the skin of their teeth, and the bill has not exactly aged well over the last few weeks if you look at poll numbers, if you look at sort of press reports, and I think most people who've responded to polls do not like the way this was done to begin with, as far as the transparency, as far as doing it before it was scored at all. So I think that's something they're going to try to avoid at all costs. The problem is they're also trying to do it pretty quickly, and they don't, because of budget reconciliation rules, and I could get into that, but it's really, really, really arcane and boring, and I'd probably make many mistakes anyway.
We'll let you off the hook on that one.
Thank you. But they do need to do this quickly so that they can do it through a 50-vote setup in the Senate.
You mentioned, I like the way you said it, the bill's not aging well. Really, healthcare has just been a heated topic nonstop at town halls across the country. Is healthcare going to help Democrats reclaim a majority in either chamber as you look ahead?
I mean, it's hard to know. I mean, but I think you've read a lot of reports, both from the field and from a lot of these town meetings, and also in some polling, that in fact healthcare is a far more potent issue to use against Republicans if you're a Democrat than even the Russia scandal stuff, which obviously has been preoccupying so much of the Washington conversation and conversation around it. So yeah, I mean, I think Democrats sense some real opportunity here, and I mean, I think Republicans in some ways have made it harder on themselves by doing this so much in secret, by really doing it very, very quickly, and also there was so much friction and static around getting the bill out to begin with. There's just, at the very best, at the very least, a lot of uncertainty about it.
However this goes down, Mark, the Senate and the House both need to agree on a final bill. Where do you see this headed?
Oh boy. I mean, I think, any notion that it's going to happen quickly is farcical at this point. I mean, I think a worst case scenario for Republicans especially is that this thing drags out even into next year so that it becomes even more of a resonant issue going into the midterms, but also that it occupies, things like tax reform, things like maybe infrastructure that had been, front and center on the Trump agenda going in. This is on top of all the FBI Russia stuff that, has taken up so much of the other oxygen. So I think both the combination of time and also the details of what this could do could be very problematic for Republicans.
Mark Leibovich in Washington. Mark, thank you.
Thanks for having me.